I am the Oncology Pharmacist at Rob Ferreira, which basically means that I mainly deal with oncology patients. It's not just giving you the medication. It's just knowing what is in that medication and knowing whether it's safe for you. You work with stock management, ensuring that the medication actually arrives to the hospital. You work with doctors.
Yes.
You become, I think the words that we normally use is liaison. Right?
Yes.
You become a liaison between Ewotini and you become a liaison with people in pharmacy as well. I'm the go-between. You learn to get to learn people's tendencies, temperaments, and talk to them. And you like, when you learn to talk to someone, be like, no, ipilise lodwa, eksene mina ntambama, mara wena ngiyakwazi ukuthi wena uthanda into ekanje, mawuthanda into ekanje hayi, wena mele uthathe nje vele mawuthanda ukudla lechakalaka yakho nana.
Hello, family. Today we are with a special guest, my go-to person, Itumeleng Shai. Hello, Itu.
How are you, Doc?
I'm good. It's nice to have you here.
No, it's a pleasure. I was not expecting this. So this is a very pleasant surprise.
That's great. Itu.
Yes.
I want to welcome you to our family, and I would like for you to introduce yourself to us. Who is Itumeleng Shai? Itu? Wait, who are you?
Okay, so Itumeleng Shai is a 32-year-old institutional pharmacist from Rob Ferreira Hospital in Mpumalanga, Nelspruit.
A very committed one.
People say to a fault. So I am the Oncology Pharmacist at Rob Ferreira, which basically means that I mainly deal with oncology patients, cancer patients. We mainly work with giving them chemotherapy, which is what people know to take your hair away in terms of treatment for cancer.
Lord.
So basically, I am a pharmacist who prepares a treatment for cancer and also helps in terms of monitoring our patients that receive a treatment for cancer.
That's a good space, eh? You're helping a lot of our patients, and we see it with you every day.
Yeah.
So, Itumeleng, tell us, what made you be drawn to becoming a pharmacist? What was your journey? How did it start off? Like, you can go from you telling us about your childhood, how you grew up, and so that reflects on who you are. It also reflects on who you are now.
Yeah.
How did it come about that you chose this career, or did it choose you? We don't know.
To be honest, it chose me.
Yes.
It chose me. I think for me, I'm a Sowetan born and raised.
Yes.
So basically, Soweto has been where I've been wanting to help abantu ekhaya vele. So when I think about things like that, so I started. It all started like post-matric.
Yes.
I actually wanted to be a pathologist, a forensic pathologist. Which is actually not something that the parents want you to do.
Hey, they don't even know what's a pathologist.
Usebenza ngemzimba, usebenza ngabantu abafile nani. Like those types of people whereby if someone khona umuntu oshonile and then you are doing the
postmortem.
Exactly.
Yeah,
so it was something that the parents did not really go for.
Yeah.
And then so when I was doing biomedicine at university, I realized I met some pharmacy students who actually told me about it, and they're like, yes, when you're actually pretty, you fit rather perfectly for a pharmacy as a profession. So as they told me about the profession in pharmacy, we spoke, and the more we spoke, they made it seem like this is the type of career that I want. Yeah. So they definitely helped me find my way. And then so basically did pharmacy for 4 years, record time as they say.
Yes.
And then after that did my internship. After I could have gone to do the masters and the whatnot, but I learned so much in the University of the Western Cape, working in Cape Town, that I felt like there were some skills that I could bring home.
Yeah.
So I wanted to bring something to Soweto,
Yes.
you know. So did my internship at Itumeleng Soweto. And then I did my community service at Baragwanath.
Oh, the busiest hospital.
One of the busiest in the world.
Yes, definitely.
One of the most exhausting workplaces.
All the hard workers are like, we want to go there.
And then
all the other ones are like, no.
After a week, you get exhausted because I remember as an intern, like my tutor said, remember to take lunch. And you do not take lunch because there's so much work, you know. But basically, after ComServe, I became a fully fledged pharmacist.
Yes.
And as I say, it called me because I just got a call one day. They're like, Rob Ferreira Hospital in Mpumalanga needs an oncology pharmacist.
Oh.
Just like that. And I was like, okay.
A call is what made us be close like this. I applaud that call. Wherever it is, whoever made that call, I'm so happy.
Because a lot of people don't really like oncology because of the type of medicines that we use. So
they're harsh.
Yeah. So because of that, they were like, okay, no, you're someone who actually really likes the field of oncology and we need a pharmacist. And then once I got in there, it was actually amazing because I was actually allowed to experiment as much as I wanted.
The art of it.
Yeah. So just basically what I was able to experience as a fully fledged pharmacist. I was able to do things to improve the type of service that we provide in the province. So it's an amazing experience, and it's something that continues over time. So I am only getting started.
You know what? As you're speaking, Itu, you are always running around. We never get a chance to. You're like, yes, doctor. 1 second, Itu is there running. Itu was here. I'm like to the nurse, Itu was right here. No, Itu has already left. Even if a patient just was trying to follow you, I'm like, no. But they're like, no, 1 minute, Itu is already at pharmacy. The way you do the runarounds, Itumeleng, you know what? I can say this with all the doctors that have been working in oncology as it started in the middle of it, and now as a whole department that's standing in Rob Ferreira Oncology. We all appreciate you, Itumeleng. You know the work you put in. The sweat and the steps. If I give you my watch, Ibile, where's my smartwatch? You know what? I'll hit my 9,000 steps like in no time.
Yeah.
You are such a powerhouse, Itumeleng. Can you tell us, as the family, there's people that wish to be pharmacists as they grow up. They want to dispense, they want to do this and that. Or maybe somebody has stumbled, just like you did, has stumbled upon becoming a pharmacist. How is it on a daily basis? What does your day look like as a pharmacist in oncology and general, just a normal pharmacist, and then you can go to the oncology part?
I think the most important thing is the pharmacist that you see is not someone that there's a very big difference between what you see at clinics and what you see in a hospital setting.
True.
I think that is the biggest distinction that we need to make, right? My day as a hospital pharmacist, number one, basically the volume of patients that we see is much larger than what you see at a clinic. It's a public hospital. And it's a hospital, number one. It's a public hospital, number two. So the type of patients that we are able to service, right? We deal with a vast, a long list. Yeah, a long list of patients that we are actually able to assist, right?
Yes.
So I think the best thing that I can start with, in terms of being a hospital pharmacist, the type of diseases that we come across, right? The main thing that we do is we dispense.
Yes.
We dispense medication for a lot of diseases, your high bloods, your diabetes, your TBs. Yes. So the person that you see in the pharmacy is not just giving you the medication, right? As a pharmacist, I am supposed to know how you take your medication. So it's about taking the right dose, the right medication, the right dose at the right time to make sure that it's safe enough for you to use. It's to make sure that it's effective enough to cure or to manage whatever illness that you have, right? So that is the most important thing that a pharmacist has to do. So basically, in terms of being in a hospital, it's not just giving you the medication. It's just knowing what is in that medication and knowing whether it's safe for you, right? So you'll find people with high blood pressure, people with ushugela, and they're taking like 16, 17 different boxes of medication,
What's
right?
it called? Polypharmacy?
Yes, polypharmacy is actually the correct word. But some people have a lot of illnesses. You know, someone has arthritis, diabetes, high blood, and basically the doctor will write the prescription because the doctor has assessed that patient, right? But with us, the most important thing is we actually have to know, in terms of that tablet, whether it's a tablet, whether it's a syrup, we have to know what is in that tablet and how it will affect you. The doctor knows how it will affect your body. But with us, we look at whether it's a syrup and we look at how it actually affects you. Like where the moment you drink it, how it will affect you, right? So that's the most important thing that we do. In terms of working in a hospital, there's also stock management. You know, those
the
boring
behind
topics.
the scenes.
A lot of times you think you only see 2 people in front. Those are the only pharmacists. There's like 20 people at the back.
There's a whole team.
There is a whole team. And we deal with inpatients and outpatients as well. So we deal with the medication for the patients, and then we actually service them as well. We also look at their prescriptions. We give them the medication that is also right dose, safe, efficacious. We also have to attend to those patients as well. When you think of someone olele, right?
Yeah.
Olele lapha embedeni. You always have to think of the medication le ayitholayo ifike kanjani lapha ewardini. The pharmacist is the one who ensures that the medication arrives to the ward itself. So, inpatient pharmacist, outpatient pharmacist, as a specialist, as an oncology pharmacist, it's actually you're an all-rounder. You work with patients abe cancer alele lapha ewardini. You work with patients ayekhaya. You work with stock management, ensuring that the medication actually arrives to the hospital. You work with doctors. You become, I think the word that we normally use is liaison. Right? You become a liaison between ewardini and you become a liaison with people in pharmacy as well. I'm the go-between. So in terms of the runaround, that's why we do the runaround, right? I am able to do the runaround to take messages from pharmacy to doctors. I'm the go-between between the doctors and the pharmacists. I'm the go-between with the patients and the pharmacist as well in terms of cancer. So as well as the preparation of the chemo, and there's so many things. So my day is preparing chemo, preparing medication for patients who go home, preparing medication for patients abase wardini, and then doing all the boring paperwork.
Itumeleng.
It's a lot.
It's a lot. It is a lot. You know, somebody looks at the pharmacist and they say, it's just a person who's giving out the medication, who's just there in that window between your script and getting that thing. I want to check with you. You know, you do your work so... Hey, you are such... I don't even know how to name you. You know, if I make one mistake, Itumeleng will be giving me a call and say, Tabete, did you check that you put Lasix 120? What's going on? You know, okay. I love that about you, that you actually... No, it's not only you, even the other colleagues of yours, like I can mention, Iris, she does a good job as well. So I'm like, these people are people who are holding us together as the whole hospital, because we cannot give the treatment that we are giving without you guys. You actually are the frontliners of the frontliners, So I just want to check with you, Itu. Ugogo ekhaya, uyafika umkhulu or una 98. You know our patients. Hey, they are the oldest of the oldest and they are the youngest of the youngest as well.
Yeah.
So how do you speak to a lay person or a person who's not as educated as you are as a practitioner? You know, how do you tell them about taking medication? How do you relay the message in a way that these people cannot be exposing other people to the same space? In our space, we know that abogogo, they share our medication to each other. Umuntu athi, "Ay, nami nginoshukela, ngiphe lo uphuza khona. Hey, nami ngino high. How do I go about it? How do you counsel these patients and say, you are a patient alone. We are dealing with you as an individual person. How do you find a way through that? The youngest of the youngest, the oldest of the oldest, the stubborn of the stubbornest, and the ones who know everything, who have Googled everything. How is your go-to space? How do you do it when you deal with all these personalities and making sure that these people are getting the right treatment that you are dispensing as a pharmacist to them?
I think the greatest challenge is actually the Dr. Googles, the ones who use Dr. Google, ChatGPT.
Oh, Jehovah,
you know,
wasenza Elon Musk.
And apparently manje sokno Grok 5 or Grok 4. Exactly. So I think those are the most challenging, you know.
Yeah.
Because oftentimes what we learn in school is we will teach you to be as technical as possible.
Yeah.
Be the best pharmacist ever, to be as technical and as proficient as possible. But once you've leveled up your info and you use all that jargon, all those big words, once you enter the world of work, you need to step it down.
You come back to home.
You have to come back to the point where you are presenting that same information to a person who has never studied pharmacy.
Who has never opened a book.
Exactly. So that is a really great challenge. But I think in terms of us, one of the things that for me has actually kept me abreast of providing information and assisting people like that is basically we do a lot of outreaches.
Yeah.
I've done a lot of outreaches from internship. You know, we do have September is Pharmacy Month.
Oh, yes.
With Pharmacy Month, we always get a topic.
Yes.
And then, so this year, the topic was we were supposed to advertise pharmacy as a profession, right?
Oh, there was Pharmacy Day in Dantoni.
Yes.
Oh, yeah.
You know, one, I think it was Think Health, Think Pharmacy.
Think Pharmacy, yes.
Where we went to different sites, we talked to different communities about pharmacy as a profession, and it allows you to engage with lay people in different environments, and you're able to learn to also to master the diction and to master the language that you are able to provide to people, to the point where it's almost second nature. You know, I don't say hypertension, I say high blood.
High blood.
I don't say high blood. Sometimes I say high.
Yeah,
so
number one.
It becomes second nature because of the engagement that I've personally had as an intern. You know, as an intern, I went to clinics, I went to high schools, and as a comserve, I was able to do my open days at Bara.
Yeah.
Even at Rob's, we used to have open days in September as well. Yeah. I think 2025, I'm not sure if it happened, but there are open days as well, which allow us to engage with the community. So you get to understand how they think, how they reason, and how you can best communicate, you know. And then in terms of giving information on medicines, the best tool that I saw, I think for me, when you're working in cancer, you're working with older people. You know, a lot of times.
Most of the time.
Now we have pediatric cancer.
We even have a whole ward.
Yes. So now we have pediatric cancer, so we talk to mothers as well.
Yes.
And the main thing is you need to make people feel comfortable. And big words do not make people feel comfortable.
You need to establish a good rapport.
Yes, you need to build that relationship. And being a specialist or being a specialist pharmacist allows you the time to build that relationship. You see that same patient for 6 months, a year, 2 years. some patients have known me for 5 years.
Oh, Itu. Patients will be like, no, we want Itu. No, Itu is coming. No, I'm not going to fetch my medication. Itumeleng is going to bring it for me. And if you're not there, we feel it. We feel it so badly.
So that relationship has allowed me to talk to them on a much more personal level. You learn to get to learn people's tendencies, temperaments, and talk to them. And you like, when you learn to talk to someone, be like, no, ipilise lodwa, eksene mina ntambama, mara wena ngiyakwazi ukuthi wena uthanda into ekanje, mawuthanda into ekanje, hayi wena mele uthathe nje vele mawuthanda ukudla lechakalaka yakho nana. And you get to learn people's tendencies. So for me, it became natural because I got to know the patients.
Yes.
Which was just a blessing because of the specialty that I'm in, But the main thing, just on a general note, as pharmacists, we are taught to dumb it down. Like one of my colleagues once said, like she was asking me a cancer question.
Yeah.
And she said, explain it to me like I'm 5. Explain it to me like I'm a 5-year-old.
I don't know anything.
Exactly. And we challenge ourselves like that. We actually did a very interesting challenge in the pharmacy this year. Where we challenged each other to not speak in English. That was during Heritage Day. And it was actually such a cool exercise because we were able to relay information in our mother tongues, in our lay tongues. And everyone was speaking like different languages. It was like an episode
so you must just hear whatever the person is saying.
It was like umvango.
Yes, with like generations and and
it's a nice challenge because we were actually able to relay information, and it was such a great engagement amongst ourselves as pharmacists and even amongst patients. So it takes a lot of practice with us pharmacists, but you need to understand the info before you relay it. And I think that's the one thing that we as pharmacists, I can say, have.
That's so good. Itu, you as a pharmacist and the pharmacists that we have at work, you work in close relation with the doctors. You work in close relation with the nurses. So I want to check with you, how do you maneuver your way around being okay in relation with the doctor, in relation with the nurse who says, I'm advocating for the patient, but this doctor is saying, I'm giving this dose because I think this is right. They clash all the time.
Yes.
You'll find a doctor saying, I'm prescribing this, and the nurse will be like, no way, it's not for my patient.
Yeah.
And sometimes you'll find a nurse who thinks the doctor just prescribes something that's not good enough for them, that makes no sense. And that time the doctor went through and thoroughly studied whatever and said, I want to give this patient this thing, something new, something that nobody knows. And remember, we in oncology, our nurses are specialized, so they know more than the doctors on ground. You understand? So when we bring out something, they're like, this one I don't know. I've been treating cancer patients for a long time, and I've never heard a doctor say, ICD, and I'm gonna put this drug inside to make sure that this the water, you understand, comes out, and then I'm speaking in lay terms just to accommodate the viewers at home. So we just put a needle, we do this, and then we put this. It happened. This is a reality for us. It happened in oncology where we got to do things that are not experienced. They're not experimental, but it's something that's new to a nurse who studied oncology 3 years or 5 years back.
And they're not common.
And then the doctor who knows and does workshops, and then they taught them, we can use the same drug that we use IVI. We can put it inside the patient's lung to decrease the water or whatever, So how do you deal with those dynamics that you need to be a good person to the doctor, a good person to the nurse, and a good person to the patient that you're serving? So how do you do that? It's such a dramatic field.
I think the best thing for me, I think I'm fortunate because I have a very calm and cool temperament, I never overreact to situations. Which has led me to never really argue or have like heated exchanges in our unit, When I think of or when you, unfortunately, in the health sector, here's what the one misfortune that we have is there's a lot of egos.
Yeah.
Number one, there's a lot of smart people in the health sector. You have a lot of smart doctors, smart nurses, smart pharmacists, smart everything. You can
even
argue
patients.
You can argue with a dietitian.
Ooh.
You can argue with a physiotherapist. Everyone has studied. Everyone has a certain amount of knowledge. And I think for me, I have the one thing. I think when I was in university, we learned a lot about working in a multidisciplinary team. You know, a team with different specialties, different fields, but all working towards a common goal. When I learned that in third year, in fourth year, I took it to heart. And I tried to practice it as much as possible, you know. It's definitely helped me in the oncology field. So when actually it helped me to the point where when the nurses come to me sometimes before going to the doctor, because they're like,
that.
"Hey, Itu, what do you think about this?
What do you think about this?"
And I'm like, "No, man. No, that doesn't quite make sense. Let me speak to the doctor about this."
Yes.
You know, I've become a really good go-between, you know. And as a specialty pharmacist, personally, I will say you have to be a good go-between. You have to be someone who can talk to everyone, and you have to be someone who everyone else can rely on. You know, sometimes patients come to me. Patients are scared of a doctor.
Yes.
They come to me and they say, "Yas mara itu man, lo doctor kang palelanga imitie." No. Yas man, kunesilonda la, and udokotela kang palelanga something for lesilonda. Ngicela ngikhulumele naye. So because of that, and it goes back to building that rapport. Then being a good go-between and being able to communicate with everyone in a way to ensure that everyone understands this is for the patient. Whatever happens, sometimes there's clashes. Doesn't happen as much.
Not too much.
Not too much. Yeah. I remember, funny enough, when you first came to oncology.
Oh, God.
When you first came to oncology.
Yeah, people didn't know me. And I mean, I'm a person who goes through different things.
But the thing is, you are such a confident person. Nah?
Yeah.
And you fight for your patients.
I do. My patients come first.
And people are like, "Hey, this is Oklesha, no?" But like the way she does things is not how we do things.
It was
but
not
she
the
will
same.
fight for her patients.
Yeah.
And that's one of the things where I also establish myself as someone who's able to bridge that gap.
Yeah.
You know, to make sure that oncology is a family.
Yeah.
We bridge that gap. Everyone talks and everyone is able to comfortably state their opinions, you know. So maneuvering for me, it's, to be honest, I wish I had a complex answer, but for me it was really simple.
Yeah.
Because I built good relationships that are still there to this day. And even patients, nurses, doctors, whoever, they know that they can come to me, and that comfort allows us to treat patients more effectively.
All the time.
I think that has been, and the constant running and working quickly makes people like me, because they're like, no, yes, go to eat will solve my problem now.
We always, all of us actually.
He's not going to solve it tomorrow. So that has worked in my benefit as well. But yeah, I think maneuvering is just being someone who's open and who's willing to talk to all parties.
You know, it's not easy to, like you said, it's not easy to find your way amongst brilliant minds.
Yeah.
People who are way educated. They are overachievers. They are your top 3 in class, you know. Imagine bringing all those personalities to work together.
Everyone at that hospital was a top 3.
Do you understand? So you're dealing with somebody who was number 1, number 2. You know, all of us are in the same space, and all of us, we want our prince to be the one, you know. We all want our shine to shine in order for our patients to thrive, you know. So I'm like, Itumeleng is a person who's able to capture everything and still stay true to the book.
Yeah.
I don't know how you do it, you know. I'm asking myself now as you're speaking, I'm like, Itumeleng, yes, you can go back and be lay and talk to ugogo, umkhulu, umtana, and all those things, and talk to unesi, explain why is the doctor doing this. How do you keep up to date? What do you do to keep up to date to the modern medication? Because, like you saying, when I came to oncology, I was a person who wanted to explore and always be putting my patients first. And I was somebody who does things that they are not used to.
Yeah.
If I know this is one thing that must work, I would push it for it to work. I would even push, even the people that come with new medication. I would even say, I'm having this person to come and talk tomorrow to teach everybody this and this and that.
Yeah.
So how do you keep up to date? Because I know the reason that I'm always in conflict with people is because I read a lot. It's because I'm always doing something. I'm always doing this course, doing that.
Yeah.
So how do you keep up to date so that you know that what you're giving to the patient is something that's resonating to people who have researched now, not just your old school thing that you learned in varsity?
Yeah. I think, okay, so couple of answers to that.
Yes.
Number one, you need to have the passion and you need to be driven enough to actually want to read. Like at university, I had this, he was Dr. Kutsia at the time, but he's Professor Kutsia now. And he said, I read an article a day. And he was our clinical pharmacy lecturer at the time. He's like, I read an article a day. I don't say I read an article a day, but that was what was prescribed to you. Yes.
That was your prescription.
We read, I think the reading has to be, it cannot be arduous. Yeah. It cannot be something that you're forced to do. It has to be something that you want to do. It has to be something that comes naturally. Yeah. And when you surround yourselves with the type of doctors that we have are, because oncology is sort of new to Mpumalanga, the doctors that we've had come to Mpumalanga as people who really want to push the oncology as a specialty, people who really want to push boundaries. And they've challenged me too. They've challenged me to sort of also keep up to date, be in the know, because they also want to be innovative. They also want to show that, okay, we can offer the best of the best. So I've had challenges from doctors that I've worked with, people like yourself, where if it's not even in the sense of just treating their cancer, we provide holistic treatment.
That's what I do all the time.
The patient with cancer still has pain. They still vomit. They still having maybe issues with ulcers. They still having heartburn. They still having all of these ailments, and that idea of holistic treatment
approach.
And it challenges you because you cannot stay stagnant. You have to keep.
When you say that, like patients come in polypharmacy. Patient with arthritis, something so simple, would come in with a lot of analgesia that's been given, which is for the layperson or the community, painkillers. They'll come in, and then like last week I had a patient, and I asked them, okay, does your stomach not work? You understand? The fact that you are doing a holistic approach, I'm already asking about, do they give you enough things that will help your stomach not to be constipated and stuff like I always give my patients with polypharmacy something to release the stomach. You understand?
I think oncology
a lot of them, it did. It did.
Yeah.
It did. I give that to oncology.
Yes.
I give that to the vet consultants that worked with me close, and I give it to you as well. Because if I leave that lactulose, you will tell me, Nhlanhla, you'll say, Tabete, you forgot. Can I give it? Then I'm like, oh yes. Then now I know if somebody's having too much analgesia, they need to be released to go to the toilet. And when I say that to a lot of patients now, I'm working in OPD South because of the incident with non-Dumiso. So when I get there and I talk to a patient, I'm like, I'm going to give you something to make you be able to go to the toilet for number 2. They're like, how, doctor? I've never had this. I'm so grateful for this. It's something, you understand?
Yeah.
It's something that so small,
Yeah.
but it goes a long way. You understand?
Small
That
victories,
builds
man.
for what you said, Uguti. You're not just treating a cancer.
Yeah.
You are treating all the symptoms that you are giving a person with the medication that you're giving to help them. So that is so applaudable. So I'm just asking now, ne? In terms you've worked in public for a long time now. What is the goals that you have for yourself, as Itumeleng? We know you're passionate about a patient. We know you're passionate about the colleagues that you work with. We build a family structure. My mom holds you dear to her heart. She loves you for days. Even when you didn't have a t-shirt outside court, she made sure, she was like, no, Itu must get a shirt. And she didn't even know your name, but she knew you're my person.
Yeah.
So she made sure, and when you don't have water, she will come and bring it to you. So I'm like, with you, what are the goals that you are seeing you need to go and do, or things that you feel you want to do for the sake of doing them? As an Itumeleng, you're so close to my heart. I don't want you to forget that. And I'm sure you know.
Without a doubt. Without a doubt.
So what is it that you dream about, Itumeleng?
I think for me, in terms of the profession, number one, in terms of my growth within the profession, I think the very first thing that I can say is I need to expand even more. Even within oncology, you can still expand.
You can.
I remember one of our doctors actually said, there's this palliative care course where you can actually help with people who are unfortunately.
I did remember when I was doing it. Yeah.
Yeah. People who unfortunately are at that point where they might be too far gone in terms of receiving end of life care.
I think tender love and care. We say TLC.
Yes, so people end of life care, TLC, people who it just making that time of their life as comfortable and as painless and as convenient as possible, So I want to get into that. I want to do that course, sort of empower myself there. And then also, I just want to empower myself clinically as well, just to further my studies on a more clinical aspect, basically combining my current oncology knowledge and expanding it more on a clinical side. And then with that, I can be an even better pharmacist than what I am. And just in terms of, that's just studies. That's number one. Number two, I think personally in terms of like outreaches, in terms of, and research as well.
Yes.
When I was in Gauteng, we did a lot of institutional research. In the hospital, we used to do these research projects within the hospital and within the pharmacy. And we were able to be change agents. That's a term that you learn in school. Be a change agent. So it's basically those skills that can help me be a better oncology. I really love oncology pharmacy too.
I know.
So
you're preaching to the choir.
It's just one of those things where it's so natural to me. It's like second nature now. So I want to learn as much as I can there. Just expound as much as I can there. And then if I can, perhaps reach for something more, even if it's more of a desk job, but do something on a policy basis. So for me, it's just like regulatory affairs is also another field in pharmacy that's really interesting. To be the type of person that can make big decisions that cannot affect
change maker
just in Mpumalanga, but on a national level as well. So I would love to have that type of experience, to have that type of growth that can allow me to be the best version of myself.
When you say such words, you are already a whole rainbow yourself. So I'm so grateful that you are thinking of expanding. You are a big shot right now from where I'm standing.
Thank you.
I appreciate you. I'm sure every patient in Rob Ferreira appreciates Itu for getting their medication. The patient doesn't have to go upstairs and wait. You do your job so well. Because already our cancer patients, they're going through a lot, you know. So that small thing that you think is small, of you running up and saying, I'm going to get your medication for you, Mkulu, don't worry, sit here, I'm going to come back. It goes a long way. So right now, I want us to do an icebreaker. We've been so deep in it, and we can talk the whole day. Me and you, we'll talk forever.
Yeah.
So I don't want it to go that way, because we'll do other series when you tell us now, you're doing this research, you're doing this and that. So I know in you it's there. And I love you beyond love. So much. You are close to my heart. You know that.
Yeah.
So let's do a quick fire, what we call quick fire here at home. So hospital pharmacy or community pharmacy?
I think hospital. I have to go hospital for now.
Okay, I'm not going to expand on that. You expanded a lot. And then clinical counseling or inventory management? Management or clinical counseling?
That one is easy. It's clinical counseling.
Obviously, you're a people's person.
Yeah.
It's an easy one. Most useful skill you've learned?
Most useful? So
Make it
many.
3.
3 most useful skills I've learned. I think dumbing down.
Oh, that's the
Dumbing down is definitely the first one.
Oh, that's the best one.
And second one is patience. I think patience in terms of the patients.
Yes.
It sounds
so wrong, but it's all right.
It is, but patience in terms of, when you're in a busy hospital and you're dealing with different personalities, you need to have that temperament. Temperament is actually one of my favorite words. You need to have that temperament to deal with these different personalities. So patience is definitely.
I'm going to challenge you with the last one.
Yeah.
3 ways again. One that makes you not forget yourself.
One that makes me not forget myself.
Because you need to always take care of yourself.
I think. Wow. I'm trying to think of a bigger word.
A skill of just knowing that, yes, I'm a patience person, or I have these people to treat. The one that also caters to you as an umbrella. Because we need you.
Unfortunately, the term is very simple, and the term is grounded. I think that's the most important skill, where when you're dealing with the type of patients that we deal with, the type of cases that you hear, the type of things that we see. We see cases where people have wounds that give you nightmares. And unfortunately, in oncology, you deal with a lot of life and death cases, And when you deal with a lot of life and death cases, you do get to see death. You get to see death. You get to experience death. You get to be that person who has to provide that counseling, that has to provide that comfort. I remember the first time that I dealt with an RIP patient, right?
Yes.
And a palliative care. Let me just say a palliative care patient. Yes.
I love it so much.
The first time I dealt with a patient like that, I was at Bara, and my supervisor, I was, like you're seeing this grandmother, and then her grandson was told that, okay, no, at this point there's not much that we can do. I think try to spend as much time with the little one. And when I spoke to her, I froze, right? And my supervisor came and he gave her the biggest hug ever. And he comforted her. And he showed me, he's like, that you don't need to say a lot and do a lot.
Yeah.
That's what you need to do.
Yeah.
And even with us, some of the cases that we see at Rob's, people, these families are scared. These families are very insecure about what they're seeing. And they need people like us to be able to comfort them.
Yeah.
And sometimes you can get lost in that. You can get desensitized to death and desensitized to seeing these grave illnesses. But you need to keep yourself grounded. Because when you lose that, you will realize that you become very haphazard in how you practice.
Oh, Itumeleng, you've said a mouthful. Family, if I continue this talk, it'll go on for years. So I want to thank Itumeleng for coming and teaching us about all the things that we've heard today. And we pray for him to continue being the human that he is, to continue supporting the patients, supporting the nurses, supporting the doctors, supporting any person that he comes across. So as we're closing now, we believe that we heal in every way that we choose to heal in. We rise with all the experiences that we come across, and we want to thrive as a nation. So I hope today Itumeleng has shared with you a lot. So family, we are wrapping it up now. We'll see you next time. We'll have Itumeleng in another episode. I know you would want.
Sure.
Yes, definitely.
For sure. That's coming.
So yeah. So thank you so much for staying tuned. We are gonna sign out.